Our first MCQ of the video. One of the following options is not the adverse effect of estrogen therapy. Which is that? So in this MCQ we are asked about the adverse effects of estrogen therapy, and we have to identify the one adverse effect which is not that of estrogen therapy. So thromboembolism is there, fluid retention, myocardial infarction, breast hardening, nausea and headache. So actually all these adverse effects are related with estrogen therapy except breast hardening, because actually with estrogen therapy breast tenderness occurs, not hardening. So D is our answer here. Now our 22nd MCQ. The enzyme preparation of selective peptidase has the following pharmacological action or actions. So options are given: alleviate pain via bradykinin decomposition, inhibition of inflammatory edema, liquefaction and elimination of sputum, pus and hematoma, increases antibiotic concentration at infection site. All of the above. So actually all of the above options are correct about selective peptidase preparation. It is actually an enzyme, a proteolytic enzyme that can have so many functions. So all these options are true about selective peptidase enzyme. So our third MCQ, what is hemochromatosis? So options are too much iron in the body, too less iron in the body, folic acid deficiency, vitamin B12 deficiency, and cytochrome P450 enzymes deficiency. So actually hemochromatosis is iron overload in the body. So too much iron builds up in our body, and this condition is termed as hemochromatosis. Our fourth MCQ, which vitamin or vitamins can be harmful or fatal if taken in large doses? So options are beta carotene, vitamin B, vitamin A, both A and C, and none of the above. So actually the MCQ asks us to identify the vitamins or maybe vitamin that can be harmful or fatal if taken in larger than recommended doses. So these options are there, and mostly the water soluble vitamins, they are not so harmful because they are urine soluble and they can be easily eliminated from the body. But as compared to the lipid soluble vitamins, if they are taken in higher doses, then they can be harmful. So actually in these options, beta carotene and vitamin A are the lipid soluble vitamins, and if they are taken in larger doses, larger than recommended doses, then harm can occur, even they can be fatal. So both A and C are correct. Now our fifth MCQ. The most abundant cell types in the central nervous system are satellite cells, astrocytes, Schwann cells, oligodendrocytes, and glial cells. So actually glial cells are the most abundant cell types in the CNS, that is central nervous system, because they will coat all the neurons and provide insulation and better communication to the neuron cells, so they are found along with neurons everywhere in the central nervous system. So our sixth MCQ, what is multiple sclerosis or MS? So brain disease, spinal cord disease, CNS disease, multiple organ failures, PNS disease. It is actually the brain and spinal cord disease, that is CNS disease. So multiple sclerosis is actually a central nervous system that includes brain and spinal cord disease state, multiple sclerosis. So C is our right option here. Friends, moving on to the seventh MCQ, what is Meniere's disease? Inner ear condition, parathyroid disease, appendix rupture, cerebral cortex disease, and sciatic nerve disease or damage. So actually Meniere's disease is an inner ear condition. Human body needs vitamin A for skin health, mucous membranes integrity, immune system functioning, normal eye function, all of the above. Actually vitamin A plays a role in all these areas of our body, so all of the above option is the right option here. Human body needs vitamin A for all these things. Our ninth MCQ, the enzyme preparation of Selective Peptidase is obtained from silkworm, fungus, algae, fish, sheep. So actually it is obtained from the silkworm. Enzyme preparation of Selective Peptidase, of which there is a brand in market with the name Danzin and Danzin DS. So this enzyme preparation is there. It is a proteolytic enzymes and it can treat inflammatory conditions and other states like these. So it is the silkworm that is the source for Selective Peptidase enzyme. So friends, our last MCQ of this video, the preferred treatment for Toxoplasmosis is, so options are pyrimethamine plus sulfadiazine plus leucovorin. B option is trimethoprim plus sulfamethoxazole, pyrimethamine plus clindamycin, sodium stibogluconate plus metronidazole, praziquantel plus albendazole. Actually the preferred treatment for Toxoplasmosis is pyrimethamine plus sulfadiazine plus leucovorin. So actually A is the preferred treatment for Toxoplasmosis.